Welcome to another episode of Health Matters with PA extraordinaire Lynn Szabo. What are we going to talk about today, Lynn?
We're going to talk about what is a heart attack anyway. Mostly because it seems like it's going around, sadly. And
Wait, heart attacks are contagious?
no, not really. But the risk factors, some of the risk factors that people could change to avoid getting a heart attack, kind of run in groups. So, but medical people call it a myocardial infarction or an MI. Okay. And what this is when blood either slows, blood's going through the vessels that are bringing oxygen to the heart, because the blood's carrying the oxygen, right? And the blood flow either slows or stops to the heart muscle. So the heart muscle is supposed to do this important thing and keep beating, but it doesn't really have the energy it needs to do that.
What do you mean keep eating?
Sorry, beating.
Beating. Oh, okay.
Yeah,
So I think I just misheard
what?
you there.
Yeah.
Dang
beating
allergies.
has to keep beating.
Beating,
It has to
okay.
keep eating oxygen in order to beat. Typically, what happens is plaque builds up inside the vessels. And plaque is kind of another word for cholesterol type stuff. But it builds up inside the vessels that bring blood to the heart, and it clogs things up. So like a clogged sink, right? And it may even, little pieces of it may even break off and then go further downstream and clog things completely. So again, if the heart muscle doesn't get the oxygen that it needs, it can't do its job. And if it goes on too long, then the muscle actually dies. And this weakens the function of the heart's ability to pump blood. So that's what you're trying to avoid. Okay. And symptoms can be subtle for certain groups of people, like women or diabetics or people not paying attention because their ability to think clearly is impaired for some reason.
Yeah, I've heard people say that they've been having a heart attack for the past 2 to 3 days. And I always found that odd, but they didn't have severe symptoms. So they just kind of thought they didn't feel good and they find out that they're having a heart attack.
Right. Or they're too scared to go to the ER, so they're kind of going to limp through it. Don't do that.
No, that's kind of silly.
That would be bad. But classic symptoms include chest pain or pressure, usually on the left side of the front chest.
Okay. By classic symptoms, you mean typical for white men, because that's what we studied. Okay.
Pretty much. And the pain will be coming from underneath the breastbone. So you're not going to be able to poke your sternum or your chest and replicate the pain. It's more interior.
Okay. So what is it like for women, or is it different for minority groups or for?
It can be a vague shortness of breath. It can kind of be nausea and a feeling of doom. It can be pain in your jaw. The last time I saw somebody that had a heart attack, she was really focused on pain in her jaw. And if you asked her if she had actual chest pain, she said no. Sometimes nausea, sometimes just, an inability to move around and do usual life activities. So it can be super vague, or it can be the classic elephant sitting on your chest.
Okay.
Yeah. But it's behind the sternum and it's not replicated by movement, although it does usually get worse if somebody's moving around. But you can't, it's not like you can take a deep breath and trigger something that makes the pain worse. It's more like if you walked from the kitchen to the bathroom, it would make the pain worse.
Okay. And is that just because you're not getting enough oxygen to your heart because you're moving?
Right.
Okay.
So the demand goes up and the vessels can't meet the demand because not enough blood is flowing through, kind of like a traffic jam. And oxygen isn't getting to where it needs to be. So sometimes it feels like heartburn or just a vague pressure, like you need to burp. And I remember I saw somebody in the ER, I don't know, like 25 years ago, and she was an older woman, and she came in saying that she had heartburn and that she had indigestion, and her husband is standing right behind her, shaking his head no, that's not what it is. And I said, do you think it could be your heart? And she said, oh, no, it's just indigestion. If I could just burp, it would be better. And he's like pantomiming, it's her heart. And she's...
So he knew.
Yeah, he knew. And that kind of highlights something as a little aside, is that oftentimes I get more information from the people standing behind the patient and kind of letting me in on what might not be an understanding that they have that everybody else in the room has.
Is that for both genders or just typically women because we downplay what's affecting us?
It can be for men too.
Yeah.
It can be for children. It can be for teenagers. Yeah. It's just so, while I can't directly talk to those people, I can't help but notice if they're pantomiming stuff. And so that would also mean if you had a feeling that was kind of like heartburn or pressure, like you needed to burp, and you burped and it instantly went away, then that's not a heart attack. Okay? Oftentimes accompanied by nausea, sweating, and kind of a sense of doom. I really see the sense of doom thing. People really are scared.
Okay. So they just innately know that this is not normal, this is weird. And
yeah, this is something bad.
Okay.
And then, so if you're having those feelings, you would not go to urgent care. You would not wait until next Tuesday to see, or maybe 2 months from now, and so you could get in with your usual healthcare provider. You would go to the ER because the answer to the question, am I having a heart attack, is in the ER. Okay? And then sometimes people aren't really having heart attacks, but they're having kind of a restricted blood flow as kind of a warning signal, and they get a similar pain, but it's reversed by rest or medication. And that's called angina. Okay, so that's not really like a heart attack, but that's like a warning that something's going to happen. Gotcha. And angina can be stable or unstable. And this is treated differently depending on how stable somebody is. So what do we do to diagnose this? This is a reason that we might keep somebody in the ER for a long time, okay? If they're keeping you in the ER for a long time and it seems like it's taking a while for them to come to a conclusion, oftentimes what they're actually doing is watching how your situation unfolds over time.
I was going to say, like when you do that blood test, don't you have to do another one in an hour to make sure that, and then you do a third one if it's not quite conclusive?
So they start with an EKG and then they do the blood test you're talking about. And usually that's troponin. Well, they look at a person's troponin levels. And troponin is a chemical that circulates in the blood after heart muscle has actually been damaged. And they're looking to see how it changes over time. Okay. Now, in the meantime, if they really think you're having a heart attack, they have something called Mona greet you at the door. That's how we remember it in medicine. Yeah, you thought medicine was hard. We just have all these weird sayings. So it's how you treat a suspected heart attack in the immediate sense. And so Mona stands for, the M stands for morphine. The O stands for oxygen, the N stands for nitroglycerin, and the A stands, what does aspirin? Aspirin. So those are the four things that if they think you're likely to have a heart attack, they're going to get on board right away.
All right, so with my family history of heart disease and things and all of the other stuff, I have been prescribed by the cardiologist to take a baby aspirin every day. If I think I'm having a heart attack, do I take another one? Do I chew one up really quick and then on my way to the ER, or do I wait till I get to the ER and then let them give me one?
I would chew up 3 really quick. If they're baby aspirin, I would actually chew them. Okay, I wouldn't swallow them and wait them for it. And the reason for that is it's actually absorbed directly into your bloodstream through your oral tissue. Okay. And unless you're allergic to aspirin and shouldn't do that, it's not really going to hurt you. And it could probably help you. So that's why a lot of healthcare providers of a certain age carry aspirin, chewable baby aspirin around in their, like their purse or backpack or briefcase or something. In fact, there was actually in Humboldt County, there was married couple who were both physicians, and they had the grandparents over. They had kids, and so the kids' grandparents were over visiting, and they were walking through sand dunes out on Samoa, and the grandparent went down, and they happened to have aspirin on him.
Wow.
And they got to the point of actually having to do CPR, but they brought the individual back.
Oh, good.
So if you're going to lose in the sand dunes, make sure you're with doctors who have aspirin.
That's probably a good idea.
It was wild.
Good advice there.
It's a wild story. But anyway, and so they're also looking at how your EKGs change over time. And so EKGs represent, it's kind of a visual understanding of how the electrical activity in the heart is happening. And you can, if the electrical activity, if the heart muscle is strained in some way, it changes how we see electrical activity moving through it. And so that's why they have you on EKGs for a long time. They're looking for changes over time.
All right, so if those little wonky lines become extra wonky and they're not consistent, then that's a sign for the docs? Mm-hmm. Okay.
There's a lot of things that you can learn from those, which whoever thought to measure them was, must have happened, I don't know, probably in the 1930s or something. I did a show on EKGs once, and it's kind of fascinating what trained medical people can actually tell about what's going on inside by those wonky lines. Wow. Mm-hmm. So if somebody actually has a heart attack, there is not a lot of time to solve the problem. But treatment varies from surgery to remove the clot. And they try to get, if people need that kind of surgery, that's where they're flown out to Medford or Reading. And then medications to cause the arteries to expand in their diameter, so to make the actual walls of the arteries, expand. We would call it dilate, so that blood can flow around whatever obstruction is going on. I think that's cool.
That is cool.
Yeah. And then they also give people medication to thin the blood so the blood can sneak through little nooks and crannies faster. Okay. Yeah. And that also keeps damage from happening from clots. Some people actually go on to have stents, which is like a little, it's hard to describe. It's like a
it's the Chinese handcuffs that you put on your fingers, mm-hmm. and then it's collapsible, and then they push it out.
Right.
And so it keeps your veins open. And that's the best way.
It keeps your arteries open, yeah.
Yeah, the arteries open. And so
the blood vessel open.
And it's, what is it made out of? It's like some kind of alloy thing, metal-y thing.
Metal-y thing? I thought it was like non-reactive plastic thing.
I have no idea what it's made out of. I'm just asking. But yeah, that's what it looks like inside of the artery. And it's really trippy and cool at the same time.
Yeah, exactly. So, and they put those in through your leg most of the time. But I suppose they could also actually replace the vessels that are completely clogged and scarred down. So that's where that's open heart surgery. We call it a cabbage. But what that really is they take a blood vessel out of your leg and they recreate it so it can have a clear highway to bring blood to the heart muscle.
Is that what us lay people know as a bypass surgery?
Yeah, coronary artery bypass graft. That's why we call it a cabbage. So
you're not just sticking produce in our chest when that happens.
No, but we talk in our own language.
Yes, you do.
And CAD for cabbage used to be a diagnosis when I was in school. That means coronary artery disease, being admitted to medicine before they're handed over to cardiothoracic surgeons for coronary artery bypass graft. It's just faster to say CAD for cabbage. So anyway. So after somebody's had a heart attack, risk factors are corrected, ones that are correctable. So people are advised to stop smoking, lose weight, improve diet, treat their cholesterol. And can I have a little rabbit hole on this one? Statins are not evil. Okay.
That's like the Lipitor and those types of things. All right. So
And they're drugs to lower cholesterol. They help to stabilize the plaques. They definitely improve your numbers. There's some question with legitimate medical discussion on whether having better numbers means better outcome. But it's not Big Pharma's attempt to, get a bunch of money. They're all generic now, so there's nobody makes money on them.
No, I pay cash for mine, and I'm on the Lipitor, and it went from 20 milligrams to 40 because I'm not bringing my numbers down quick enough. And again, both my parents had heart disease, and my dad killed over at 64, so it's not a good idea for me to keep with my numbers and all of the other things.
I mean, are you going to take that chance until science decides what the real answer is?
Right. He chose not to take the statins and the cholesterol lowering drugs and do those other things. And when he was my age, in his 40s, 50s, and he was gone at 64, lost his leg at 62, not to diabetes, but to the
peripheral vascular disease.
Yeah. So it's, I'm choosing to go the different way. Evil or not, I'm choosing to go a different way.
Yeah. And nobody on the internet, no influencer all of a sudden could say that carrot juice is going to cure you. But anyway, but I digress. Okay. So risk factors again: stop smoking, lose weight, improve diet. And really a heart-friendly diet is a Mediterranean diet. And it's kind of easy to do. It's not, like if somebody goes keto, you have to plan ahead and it's a radical departure probably from how people usually eat. But Mediterranean diet is way more flexible. And especially in the summer, and especially for people that garden.
Especially in California, right?
Yeah, totally easy to do.
I'm gonna go the rabbit hole here too. What do you do if you're diabetic for the Mediterranean diet? Because that's heavy on pastas and grains and that type of a thing. And is it diabetic?
Whole grains.
Just do whole grains?
It's not. I don't have the understanding that it's heavy on pasta. I think it's more fruits and vegetables and whole grains, a little bit of wine actually for the people that would be a good idea for, and olive oil.
Just most of the recipes I have seen are carb heavy, whether it's from the fruit or it's from the pasta or there's orzo salads and things like that.
There's also an understanding about portion size and pasta. A serving of pasta, and this broke my heart. Literally, probably. It's only a cup.
Yeah, it's very sad.
It's very sad.
But we don't eat that way either. So it's following the Mediterranean diet and having portion sizes that are appropriate. Mm-hmm. That makes sense.
To make your portion sizes easier to control, you just go down to St. Vinny's and buy smaller plates, and it does something to your brain that makes you feel fuller sooner.
Absolutely.
So treating cholesterol, taking blood thinners like aspirin, and start exercising. So, it's over the years, we always arrive at this list at some point.
Right. So, and then you've defined exercising to me, which I actually love, is it's not going for a run. It's not intentionally going out and lifting weights. It's being in your garden for 20 minutes a day. It's vigorously or intentionally doing an activity. So I just dance around when I'm washing my dishes and doing the kitchen and try to make sure that I spend at least 20 minutes having fun while I'm sweeping up my hardwood floors and turning on the music. And so it's a little bit more movement.
Try to commit to a more active lifestyle. And, this is something we can do in Del Mar. We have the beach, we have the redwoods, we have the pool, which is my fave. But one thing we don't have is that we don't have a resident cardiologist, although we have excellent cardiac care in the nearby counties. And so I had a patient recently who had an MI and was told to go to cardiac rehab. But she was told that the only cardiac rehab that we could access from Del Norte was in Coos Bay, which I don't think is true, number one, because St. Joe's advertises cardiac rehab, and so does Sutter.
What do you mean by cardiac rehab?
Cardiac rehab is after somebody's had a heart attack, they kind of get reintroduced to a healthier lifestyle, and it includes exercise, but it's exercise in a controlled environment so that they don't really maybe go too crazy and hurt themselves.
Gotcha.
Okay.
It could just be that was all was available to them based on their insurance. So
It might, but I think it was because her cardiologist is working out of Medford, and the understanding is about Oregon resources, not so much Northern California resources, which is a common problem for people up here. So I'm going to talk to her about maybe going to St. Joe's. But still, that's 2 hours down, probably an hour or two there, and then 2 hours back, and you have to do that twice a week.
right. And then for anybody listening to this, don't take your friend's word for it because everybody's insurance is different. The situations have changed. And literally every month we are getting more and more resources with Oregon if you're on partnership. So go to Open Door, ask for member services, let them find out for you where you can actually go, and then advocate for you to be seen someplace that's closer.
So the website I went to, Sutter, was advertising for cardiac rehab programs, but I don't think they were talking about the Sutter up here. I think they're talking about the Sutter somewhere else.
Maybe. I don't know. I haven't looked into those things for a bit. So
Yeah. So anyway, weird little factoids, because this is what keeps me sparked on medicine. Traditional risk factors for heart attack or coronary artery disease are male gender, hypertension, aging, smoking, low levels of physical activity, alcohol use. But there's other weird ones that I didn't think about. So risk factors like lower socioeconomic status. That sounds like Del Norte.
Higher ACE scores.
Mm-hmm.
Yeah.
Shift work.
Yeah.
Yeah, that blew me away. So there's a lot of nurses out there that we should worry about. Use of nonsteroidal anti-inflammatories consistently for more than a week.
Wow.
So a lot of people in chronic pain who had previously been on opioids who are now pretty much on 800 ibuprofen 3 times a day in perpetuity.
A lot of us have taken ibuprofen for more than a week when we've had an injury. I know I took it for 2 months before they did surgery on my knee every day, twice a day.
So it ups your risk for coronary artery disease. And weirdly, endometriosis in women where it's symptomatic under the age of 40.
Wow.
That seems random to me. I don't know how you could tie that together unless the endometriosis is actually
growing on your heart,
growing inside your coronary artery.
Jeez. And it can grow anywhere.
That sounds creepy. And then there's 2 kinds of weird heart attacks that are related to more to constriction of vessels. The first one is called Prinzmetal's, because Dr. Prinzmetal was the guy who described it first. And it occurs in women, and it occurs while they're sleeping. So it's kind of the opposite of what we think usual cardiac disease or coronary artery disease happens. And so for some reason, at about 3 or 4 o'clock in the morning, an otherwise healthy woman is going to start to develop chest pain. And that's called Prinzmetal's angina. And to me, that the word angina means it's reversible with proper care. But it needs to be recognized. And I can just hear the number of women who said, I have that. And my doctor told me I was having bad dreams and just waking up with anxiety.
Anything the woman has is anxiety.
Yeah, and if you were doing an EKG in the exam room at that time, that would not be the right time to catch it, right? So and maybe put a Holter monitor on them, and that's like a EKG that captures every heartbeat for 2 weeks, and then you can actually see the changes at night when they're sleeping. And there's another weird variant called Takotsubo's, which is a sudden weakening of the heart muscle due to significant stress. And this happens, I think, more in women, and women who lose a husband or a child, and then all of a sudden their heart is literally broken.
Oh, so the people who die of a broken heart.
Yeah, and they start to get, the heart muscle is actually weakened, and they start to get like acute cardiac or acute MI kind of symptoms, and then I suppose possibly they could have congestive heart failure, but treated, it's reversible, but it's, I don't know. We carry
that's what
such
took out
burdens.
my Uncle David.
Yeah, we carry such burdens, don't we?
Yeah. He just wanted to be with my Aunt Melly, and so within 2 months he was like just deteriorated so quickly.
So we got a couple more minutes before we're done, and I really wanted to tell you I've been listening to Voices from the Swamp. Love it, Heather. Love it. These are voices that we hardly ever hear from, and we certainly talk about them enough.
Right. But we don't talk to them. We talk about them.
We talk about them.
And even now we're calling them them. We don't talk to our neighbors who are without housing.
And the interviews that you've been doing with various people and talking about their particular situations and the unfairness of what keeps them kind of disadvantaged, those are reversible risk factors, right? If we were just talking about reversible risk factors, those are things that as a society we could do better. And so I think it's really compelling to listen to it. And I don't really spend a lot of time on Facebook or, paying attention to posts and that kind of stuff. But I was surprised. It looked to me like so few people listened and so many more need to. So how would somebody access this particular series that you're doing?
It's a series under KFUG Community Square. So KFUG Community Square, anywhere you listen to your podcasts, you can find it under Redwood Voice and KFUG's Facebook page, or you can find it on the KFUG YouTube channel, the same places you find Health Matters.
Good. And I would really endorse that people start listening to it. It's incredible. And I'm actually aware of some of those people and their situations, but not with the extent that you go into it in your interviews and their opportunity and willingness to speak. Yeah. I think it's super profound and really amazing.
We've talked about it before, what community radio is, and it's everybody having a voice and having that opportunity. And I hope people hear what it is that they're saying. Lynn, thank you so much for being here and for educating us on our heart health. I'll see you next week.
Bye-bye.